She's going to give you some details about the colonoscopy and at what age do we get our colonoscopy. All right, thank you for that awesome detailed explanation. Not only are you smart, you are beautiful and talented and all that great stuff. Again, like I said, we some kin. Can you drop those?
Okay.
All right, Okay, Dr. Cuz. So we're gonna talk now about the colonoscopy. All right, I said it right that time. She's gonna give you some details about the colonoscopy and at what age do we get our colonoscopy.
Okay, so this one typically it starts at age 50. Okay. However, like I said, with the breast, the cancer, the mammograms, if you have family who have been diagnosed with the colon cancer earlier in life or at any time in life, you should start at least 5 years before that. Okay. So for instance, my grandmother, she died from colon cancer at age 50. So I would get my colonoscopy at 45. My mom got her colonoscopy at 45. I might do it at 40 just to, be safe. So it's a conversation that you'll have again with your primary care provider and decide what's best for you and what you're going to feel the most comfortable with. But typically the guidelines say you start your colonoscopy at age 50.
Now, does a colonoscopy hurt?
It depends on who you talk to, okay?
Well, I'm a baby, so I'm probably sure it's going to hurt me. Can you tell us about the procedure?
So the thing, typically a mammogram might hurt a little bit more because you're awake during a mammogram, and during the mammogram they actually smash your breast a little bit, okay? However, with the colonoscopy they do put you to sleep. But it's not the same amount of sleep that you would think that when you have surgery, okay? When you have surgery, you're completely knocked out to the point that you can't even breathe on your own, okay? With the colonoscopy, they do what's called conscious sedation. So they basically give you pain medications and anti-anxiety medications that typically will knock you out. However, if you take a lot of pain medications or do any drugs or anti-anxiety medications, you might be a little bit more resistant to the medications and you might not actually fall asleep. So we call it twilight. You're kind of in this kind of like, oh, I'm here, but I'm not here. Or you might not completely out, but if we need to wake you up, I can do like this and wake you up.
And they were like, okay.
Exactly. Whereas in surgery, I can slap you, cut you, and do all kinds of stuff, and you're not going to wake up.
Okay.
So conscious sedation, but most people do fall asleep during a colonoscopy. Now, most people are the most nervous about the colonoscopy because we are inserting a large scope into the rectum and going through the actual colon. So people tend to be a little bit more nervous about that exam. But this is my favorite exam because this is the only one that actually prevents cancer. Okay. With the mammogram we showed you, it detects it. Exactly. Okay. But this is the one that will prevent it, and I'll talk a little bit more about that when I show you the pictures.
Okay, let's take a look at the pictures.
Okay, so these are pictures of actual polyps. These aren't just animations. So this is someone who actually had a colonoscopy. They found these polyps, and this is the colon scope. And you can see it's pretty small. When you look at the wall of the colon, this is the wall of the colon. This little thing right here is very small. You're not gonna feel that much, okay? So this is what the cervix looks like. It basically looks like a donut, right? And it's at the very end of the vagina. And we've split it into 4, which shows different stages of precancerous cells and then actual cancer. So a normal cervix looks like this. It's very pink, it's healthy, it's plush, right? We've got low-grade abnormal cells. This is basically what the CIN means. It's low-grade changes in the cells. Now, typically when we find that, we don't do anything, okay? We'll have you come back for your pap smear in another 6 months to see, because sometimes your body will normalize. We have to remember that we always don't need to do an intervention, okay? We don't always have to go in and do any procedures, but we want to be monitoring you, and we want to make sure that it doesn't increase to something more high grade. Now, when you've got high grade changes or precancerous cells, this is the point where we'll typically do a LEEP procedure or a colposcopy. And what that is basically is you'll go to a specialist and they'll take forceps and they will take away all of this abnormal area of the cervix, okay? They do that right in the office. You may or may not take pain medications before you come in, but you go home the same day. It's an outpatient procedure, and then they'll have you follow up in about 6 months, and they'll do another pap smear to make sure that they've gotten all of those abnormal cells out. Now here, this this is cancer. They're not going to be able to do any procedures in the office to fix this because now we've got full-blown cancer. And typically the cure for this is going to be a hysterectomy. So that's going to be removal of the uterus, possibly the fallopian tubes and the ovaries as well. Now that's tricky because when we remove the ovaries, you go into full-blown menopause. So whether you're 12 when it happens or 71 when it happens, you're going to go into menopause. Whenever it's recommended by your provider, whether it's every 3 to 5 years, and we can prevent you from going into cancer or high-grade cell dysplasia and having to have LEEP procedures or colposcopies.
So thank you so much for all those explanations about the pap test, the colonoscopy.
Yes, you got it.
And the mammogram. Dr. Chloe, we appreciate you and we love you. Why don't you tell us how to follow you, how to find you, how to come in and get some of this treatment. Okay. Tell us all about it.
All right, so my Instagram is Chloe_finesse. There's not a lot of medical stuff on there. It's really more so my
She be cute though.
It's just my personal Instagram. You can follow me on there. But my office is at Norwegian American Hospital. We are on the west side, so Humboldt Park area. I take every insurance. Medicaid, we serve underserved. So Medicaid, HMO, PPO, we take it all. Yes, you can find me there. We're at 1044 North Mozart. Our phone number is 773-292-8307. My receptionist is going to be like, you just put out our number. That's okay.
That's okay.
Yeah, so that's pretty much it. You can come in, you can make an appointment. I'm a primary care provider, so whatever you see anyone else for, you can see me for that as well.
All right, we got Dr. Chloe Haney in the house. Snap, 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 snap. Thank you so much. Hopefully we can have you back to talk about some other medical phenomena that you're doing.
Okay.
Again, thanks a lot, everybody. Again, I'm the HydeParkTherapist. I'm Nyla Malone. She does take all the insurance. I don't. I just take Blue Cross Blue Shield, PPO, Cigna, and cash. All that other stuff, holla at your girl, but not me. Thank you so much. I'll see you soon. Peace.
All right, thanks for having me.